A, someone is B. If we don't have A and B, we say O. So this is called as ABO system. This is called as ABO system. A and B are the antigens which are inherited as a Mendelian dominant character. And individuals are divided into 4 major blood type on this basis. Type A individual will have A antigen, type B individual will have B antigen, AB blood group have A and B both antigen, and O have neither of these. So blood group can be A, can be B, can be AB, or can be O, depending on the type of agglutinogen or antigen. So as a doctor, you must know what are these antigen. Actually, the A and B antigens are the complex oligosaccharides that differ in their terminal group. Only they differ in the terminal group, but only this much is not needed. There is a H gene which code for fucose transferase that add a terminal fucose forming the H antigen that is present in all blood type. Your blood group is A, B, it is immaterial. Main thing is that H antigen is there in all blood type. Please remember, this is important point. Normally, this point is skipped in a lot of books. It is given in genome. So, A also expresses terminal N-acetyl galactosamine on this H antigen. So, H is there on A also. But this A blood group will have more what? This A agglutinin will express terminal N-acetyl galactosamine on the H antigen. And type B will express a transferase that plays a terminal galactose. An individual who have both of these is AB blood group, and the individual who have no of this antigen is called as O. But do you think H will be there or not? This is your MCQ, your Viva question. Yes, doctor. H antigen persists even in O blood group. Try to understand this point. This is very, very important point. Normally we see A blood group, B blood group, O, but we forget about the H. Now this diagram is very, very important. You can see fucose, N-acetyl glucosamine, galactosamine, and glucose. It is the H antigen. And on the H antigen, if something you can see here, this is your ceramide or galactose. It all depends on this. Ceramide is on the every H antigen. If you see ceramide is on the every H antigen, you can beautifully appreciate what is A antigen and what is B antigen. It depends on that. It is having N-acetyl galactosamine or it is having galactose transferase. Am I clear? This diagram is very important. Sometimes they can just give you this H antigen diagram. You have to represent what is in the A antigen and what is in the B antigen. Am I clear? So H antigen is in every individual.